All right, hey guys, this is our first live East Texas physical therapy video, so we're really excited. I have Jason as my patient here. He's been having really bad sinus issues for about 2 days now, and his right side is just completely locked up. So we are going to dry needle his sinuses and give him some relief. So dry needling is something that we've offered here at East Texas Physical Therapy for a while. I'm gonna give you guys some time to kind of get on and let's see if we can get a couple more people watching here. I see Emily. Hey, Emily. Jason's gonna relax and take a little nap.
Yeah.
Macy. Hi, Macy. Let you guys and I also want you guys to let us know when you have questions. So the whole purpose of this, of course, is to kind of get you guys exposed to some dry needling and also let you know that it's not just for sore muscles, trigger points. We also do a couple of needling for things like low back pain, shoulder pain, neck pain, headaches. We dry needle head to toe. A couple of the things that the dry needling has been shown with research to be most effective for: plantar fasciitis, knee osteoarthritis, headaches, cervicalgia, which basically means headache, neck pain, any issues there. Hi, Lone Star Surgery. Hey, Clay. Hey, Pat. All right, so I can see some of you guys are kind of logging on here. I can see you at the bottom. This is the first time we've done a live video. And like I said, please ask us any questions. If we don't answer it in the video right now, if I can't see it popping up, I don't really know how live works. But if you guys will comment on the video afterwards and ask us whatever questions you have, we will make sure to get back to you and kind of let you know whatever you have to ask. We'll make sure we give you a good answer. And if dry needling is something that you've never heard of, feel free to ask us questions. We're going to start doing a series of videos on dry needling to kind of show you guys some different examples of diagnoses and or problems that dry needling might help with. So if there's anything that you're kind of curious to see, let us know and give us a shout out on that. And then also, if you think that dry needling might help you, let us know, make a comment, send us a private message on East Texas Physical Therapy's Facebook, and we will get back to you guys and see what we need to do to get you in the clinic, to get you a referral over here and give it a shot. I just finished my certification for dry needling up recently, so this is kind of a new skill in my tool belt. Jason's actually been certified for how many years?
About a year.
About a year now he's been certified. So we're kind of excited. I'm excited, of course, because it's something that's new and awesome for me. And I'm going to try to show you guys too, so you can barely see this, but I'm going to take one of these out here. So it's literally a teeny, tiny, you can barely see needle. So don't be scared as far as if you're not a big fan of needles. They're very, very thin, much smaller than, for example, getting a shot at the doctor. That's going to be a thicker needle because it's actually got some liquid going through it and pretty uncomfortable. These, I would say most of the time when I'm being needled, I really don't even feel most of them going in. But we'll let Jason give you some feedback on what he feels going in, and especially since this is hopefully going to be a good pressure release. So here we go, guys. Here we go. And I have really, really cold hands, so I'm going to apologize now. And I think they can actually see me pretty good. And I'm actually going to free insert a lot of these, Jason.
Okay.
Give me some. Try to take these little tubes. All right, so now we're going to go around, and a couple of these are going to actually just go in right where those sinuses are in your skull. So the thought process behind that is that we're going to relieve some of that pressure. And this one's going to be kind of weird. We're going right in on the sinus, right over the sinus that is right kind of where your eyebrow is. And a lot of times you can push up and kind of feel the pressure relief there. So that is what this little needle is going to be doing. Painful. And now we are actually going to go right around the nose itself, which you have a big little sinus cavity right here that this is where a lot of the pressure comes from too. So we're going to go down there and hit that. off. I'm gonna freeze her beans. Jason got one going in here.
Well, I went to go get something.
This is gonna get down the bones. We're gonna let me tap that right there. Little pressure. And he's doing great. Hasn't flinched once.
No.
It's really this. It sounds scary because these needles are going into your face, but it's really not that painful. It's not painful at all, in my opinion. Up 15, barely got down there. Barely, barely. All right, we got one more.
I got a question here.
So you're saying you do acupuncture. Well, technically acupuncture is going in with a needle, an acupuncture needle, and these are acupuncture needles. But what I will say, the difference between dry needling and acupuncture follows more of your meridian or energy flow centers per Eastern medicine. And oh, he said it just released, so we haven't even gotten the last one in yet, and he's already getting some pressure release out of that. So that's awesome. But with the acupuncture, they usually go about a thumb width depth into your skin. That's about usually as far as they'll go. So with dry needling, depending on what area of your body, or if we are going to do, for example, your hip. If you've got a trigger point in your hip muscle, that hip muscle may be a full finger length depth in your hip. So me going in an inch isn't going to come close to touching that trigger point. It's not going to give you any relief. So with dry needling, we're actually going to go in with a needle that's going to get down to that trigger point and kind of break the trigger point up from the inside. The premise and the kind of the science behind it, you have these little things in your cells that build up in a trigger point called cytokines, and it's not good to have a big buildup of those in there, and that's where a lot of your pain substances come in and build up, which is what causes the pain. So we go in there with the needle, and after we kind of needle that trigger point, it immediately releases, and so that day and even the next day and the following week, you can feel the difference. I'm gonna put this last needle in Jason so he can get the full benefit while I'm talking here. All right, I'm gonna go in right. Open your eye up for just a second.
I'm gonna raise you up a little bit.
Even with the people, this is gonna feel kind of weird too. I'm on that phone. I almost need 30s on you. All right. So we've got our needles in. I'm gonna lift this. I'm gonna lift this so you guys can kind of see Jason's face. We'll get some feedback from him.
Hey, y'all. Kidding. You can't feel them when they're going in. And the last one she put in, as I was laying here, you could feel a little bit of a pressure release. So every now and then it was like a click or a pop, like your ears pop in a plane. Not that significant, but just a small. So it is helping. So
yeah, so that's awesome. And this is kind of something that's a little bit different that you really wouldn't think of dry needling necessarily being a remedy for, but oh my, I know it does look a little bit scary, but I promise the needles are so small you can barely feel them going in. So this is something, like I said, that really works well on trigger points. Other things, neck pain, low back pain. I actually needled Cassie's hip probably 4 weeks ago now, and one treatment session, and she hasn't had pain in 3 weeks. So I feel like that's a huge, after she'd been hurting for months and months. So I feel like that was some good relief and good feedback there. But I just want you guys to kind of get an idea of what dry needling can be used for. We're going to be doing a whole bunch of follow-up videos for this that kind of give you guys a view of some of the other things we can use it for. If you have any questions, like I said, please respond and ask us, you know, if something that you have may be able to be helped with dry needling. Would this work for lymph node swelling? So lymph node swelling, you're probably going to want to do more of a lymph massage for. We don't want to be inserting any of the needles into the lymph system, but but that's something that a physical therapist is definitely. We have plenty of people who are trained in lymphedema here and know a lot about the lymph system, so that's something that we could definitely help you out with. But yeah, if you guys have any other questions, for sure, Does insurance pay for this? Well, yes, it does. It definitely does pay for this. If you're a Medicare patient, Medicare also pays for this. We don't have any insurance payers right now that we don't have any insurance payers right now that aren't paying. So yes, your insurance will definitely pay for this. And it's one of those things, you're going to come in for your diagnosis, and your physical therapist, your doctor of physical therapy, Jason, me, Becca, Annette, Carrie, one of us is going to take a look at you, kind of see what you've got going on, and we're going to be able to know right off the bat whether dry needling is going to be something that we really feel like is going to help you. And we'll get that in your plan of care from the get-go, so the doctor will sign off on it, your insurance will approve it. Like I said, Medicare will pay for dry needling as well. And then, of course, cash pay is always an option if you're in a situation to where your insurance is out of control. If we've got a doctor's referral, we can definitely work out something on a cash pay system for sure, and work that out with you with our front office. Oh, you're welcome, Don. You're welcome. Yeah, so I can kind of see some of your questions going up here. So we're gonna take off the live video. I'm gonna let Jason hang out for another. Usually these sessions, most of the time, you're gonna put them in, and they're gonna last anywhere from 10 to 20, even 30 minutes. So we're gonna leave those needles in Jason and let him get the full benefit out of that. But you guys feel free to keep posting questions down there. It'll post on the bottom of the video, so we'll be able to see them, and we will get answers back to you. And like I said, if it's something that you're wondering will help you, please ask us, and we'll help you facilitate getting the doctor's referral and kind of let you know what you need to do to get in the clinic. Thank you guys so much for tuning in and watching, and stay tuned. We're going to be posting a lot more videos, hopefully live, but maybe recorded. We'll see how we do. But keep an eye out for us later on this week and in the following weeks, and we're going to be posting a lot more videos on not only dry needling, but a lot of the other interventions that we offer here at East Texas Physical Therapy. And thank you guys so much again for tuning in. And Jason says bye.